notable one was in Durban's Addington Hospital, where there have been reports that more than 50 patients, many of them on chronic medication, were turned away. The movement says it is defending South Africa's sovereignty and overstretched public resources, but human rights groups and the South African Human Rights Commission argue this approach is unconstitutional, cruel, and risks turning hospitals into battlegrounds of xenophobia. So, we asked the question this morning, what's the line between protecting public services and protecting people? South Africa's health system, I think we can all agree, at least the public health system is under enormous pressure. And what are the questions that we should be asking? Or are we simply blaming the most vulnerable in society? Joining us now is Dr. Vusumuzi. He's the chairperson of African Diaspora Network, who has long been an advocate for the rights of asylum seekers, refugees, and undocumented migrants in South Africa. Dr. Sibanda, good morning and welcome to Salam Media. I really appreciate you giving us the time this morning.
Thank you very much. Good morning and good morning to the listeners.
I think let's start here, Dr. Sibanda. Is there an understanding why many South Africans feel quite frustrated when they see undocumented foreign nationals accessing public health care while themselves sit in long queues or get turned away? Is there a meeting point and understanding of where we find ourselves today?
Sorry about that. Okay, yeah, look, I think the position that Dudula has adopted, it does not even speak to undocumented foreign nationals. Even on public media, the leader of Dudula, Zandi, has said they want to go to hospitals and check out doctors that are qualified, that are documented, that work there, because, they've come into the country because of their scarce skills and kick them out and replace them with qualified South African doctors. I don't know where she gets that statistics where she has seen South African doctors that are unemployed, whose positions have been taken by these doctors. But in any event, if they've just graduated, even if they've just graduated, it means that the system can no longer just kick out people that are obviously employed, properly documented, and some have even been naturalized. So the position that we have that says that a lot of South Africans, I'm not sure how we quantify that, because the issue is basically that these foreign nations that we're talking about, they live. There's not a single community here in South Africa that is said is designated for foreign nationals. A lot of the foreign nationals are renting houses from South Africans. They live with South Africans. They are married to South Africans. They work together on the streets. They live together. So this notion that there is a lot of people, when in my view, I think it's a group of people that are misguided in their views, that think that they can change the way things that are done, because there is policy, there is laws. If somebody is not happy with the policy or laws, they campaign to have the laws changed, not to act in the manner that Dudula is acting as such a serious vigilante. And unfortunately, authorities have not taken this seriously, but this is what's going to lead to another outbreak of xenophobic attacks before it's too long, because people are going to start fighting simply because it is not being nipped in the bud. But this misconception and view that it's a huge population of South Africa, I think it's not true.
I want to stick, on that point that you're making, that if this is not nipped at the bud, we have the potential scenario where we can go back to 2008, where we saw those horrific images of xenophobic attacks sparked all across, some of South Africa's major cities. Then the question to that would be, how do we go about it? How do we go about, bring everyone to the table and making sure that things don't spiral out of control? You don't have vigilantism running riot. You don't have a situation where you have South Africans from organizations like Dudula and immigrants and asylum seekers who are here in South Africa exchanging blows and lives being lost.
Well, look, the problem that we're having at this moment, I will not even go to the extent of blaming, these vigilante groups. I think the blame lies squarely on the government's doors. The government is absent, it's on leave, because the government is very much aware of the 2008, scenario, 2009, 2015, 16, and 2019, where a lot of property was lost. And the government, it doesn't matter. The government is keeping quiet for political expedience. And it's not that they are not aware of what is happening, because too many reports have been sent to them. We've heard the president speak and say, please, hands off, the foreigners are foreigners. But we even have, a recent critical skill that has been updated to guide employers on how to employ, our foreign nationals. We even have a preferred system with the Department of Home Affairs for people to be assisted to get visas, by companies, so that, work is not interrupted. But we're not having the government protecting these people that it is touting from outside the country to come and assist, not only talking of asylum seekers, or who are also protected in terms of the convention. So the problem is squarely with the government. The government must adopt a tough stance against people that break the law, not just to watch them, because this watching them, it is government-aided terrorism on foreign national, government-aided xenophobia. So that is why we have always said it is institutionalized, because it is done by institutions of government that are not taking, serious their responsibilities of protecting everyone who's within, the boundaries and borders of the country. So if at any stage we've got the government taking its duties seriously to protect everyone, these people that are perpetuating this should have long been taken to book, and this thing already would prevent what is going to be catastrophic in the shortest period of time, should it continue the manner in which it is continuing.
Mm-hmm. Are we not, putting ourselves in a situation where South Africans themselves feel like when they voice out their own, unhappiness regarding this situation, they're told to keep quiet. They're told, foreign nationals should be protected. But you yourself, ever since we started this conversation, I haven't heard you say, being in the country illegally without proper paperwork in itself should also be punished by the government.
Look, for starters, that's why I said Zandi has not spoken about irregular or undocumented people, but she's waging a war against, every foreign national. So in this particular instance, we're not addressing the issue of, irregular people. That's not what Dudula is addressing. We are dealing with the issue where, for example, people are attacking people that are regular in the country. We have always said as a position that people that are undocumented need to be dealt with in terms of the law unless they have regularized their stay in the country. So we are not again saying that people should not speak. I mean, everybody is allowed to speak. We've had numerous debates about these particular positions in terms of the Immigration Act. The Immigration Act has even to be revamped, including the Refugees Act, to try and tighten it. That's why you've got the critical skills, so that you don't have migrants that do not have critical skills being, employed, but only those with critical skills. So that is a forum that has been made available to every person. We've been, on television everywhere having these discussions. Everybody should speak and say that. But what we are speaking to now, what we are addressing to now, is an issue of the vigilance, the act of being physical and the preventing people against the law. The law does not prevent anyone from speaking. It prevents people from breaking the law, taking the law into their own hands, like, stopping somebody from accessing healthcare, which they're entitled to. And if that person is prevented, the person dies, and that becomes murder or culpable homicide. And in any event, what we are saying is we've seen people die during xenophobic attacks. Very little has been done. And we are saying again at this particular stage that we cannot have a situation where we have got these confrontations that are unlawful and nothing is happening about them. People must talk, must engage. They must, even if they want South Africa not to interact with other countries, let the laws be changed so that people, when they come to South Africa, they learn that the laws in South Africa do not want foreign nationals, and let them be made public to everybody in the world that South Africa is a closed economy that does not interact with the whole world, so that people don't even want to think of coming here, because people come here on the belief and the understanding that the laws are permissive and, South Africa interacts with the whole world.
Lastly, and this is a question that's coming out quite strong on our social media pages, our listeners are asking, what would you say to someone who argues that South Africa simply cannot afford to provide healthcare to everyone, including people who are in the country illegally?
When we talk about people that are in the country, we've said that let the law deal with people that are irregular in the country, do what is necessary and needful in terms of the law, that obviously they are taken to book and, deported. And in terms of the numbers of people and to that extent, but because we know the Constitution, mandates the healthcare systems to assist people that are in emergent situations. We have discussed this, including with the previous Premier of Gauteng, where he gave us statistics, where we even, as citizens say, let them give those bills to the countries where these people come from, so that we ask and they're asked to pay, so that they can be asked, why are people here and they're not documented? What is happening in your countries? So that those governments must put those bills. That should be the conversation that we're having now. How do we hold to account truant governments that do not have proper healthcare systems in their country, to the extent that people end up, coming and overburdening the South African system, which we should be all putting our heads together to make sure that truant governments, irresponsible governments are held to account. Not a situation where we are having, if we're talking about people that are regularly in the country and say the system cannot, handle them, it becomes very unfortunate, because these are people that are paying taxes like anybody else, that are entitled to these services. And they have not even refused where they are asked to pay in private institutions to pay for the services like any other person. So that becomes a very unfair, a kind of assessment and question when it deals with people that are supposed to be provided by the system. It means the government is not doing a proper, job, because it has got the stats of how many people are in the country, how many are foreign nationals that are employed by the system, and how many live where, so that there is adequate resources in the various, places according to the statistics or the population the population register.
There you go. That was African Diaspora Network chairperson, Dr. Vusumuzi. Thank you so much, sir.
Thank you. Good morning.
There you have it. As I mentioned, Dr. Vusumuzi, chairperson of the Africa Diaspora Network, weighing in on the growing debate around undocumented foreign nationals and access to public health care here in South Africa. I think there's a topic that touches on, in a lot of ways, the heart of national identity, number one. Number two, compassion, justice, but most importantly, accountability from our own government. I think they've let things spiral out of control. And it's in situations like this, when the government has failed to make sure that our borders are not porous. The government has failed to make sure that everyone that gets into the country is here legally and has the proper documentation. The government has failed in making sure that our public health system is functional. There are doctors and nurses that are being hired. There are more clinics and hospitals that are being built to avoid a situation like this. Because I think if you had more and more clinics in the townships, if you had hospitals that were functional and doctors, we have unemployed doctors in this country, for crying out loud. I don't think there's any other country in the world where you have one of the most needed skills and you're sitting at home with it. You're a doctor, you have the power to save lives, with a population of plus 65 million people who are sick. Essentially, South Africa has a range of chronic illnesses. South Africa is dealing with a pandemic that is HIV and AIDS that we've been struggling with for so many years. You have people from all across the continent and the world coming to South Africa for whatever reasons, and those people are going to need healthcare. And time again, our government has been found wanting when it comes to making sure that we have a proper functional public health care system that caters to everyone, especially the most vulnerable in our societies. So I don't think organizations like Dudula are correct in their analysis to an extent. Yes, South Africans have a right to speak out, and it's unfair that every time South Africans mention that, hey, we feel like the government is not ticking these boxes, we feel like people are here illegally, and they're branded as being xenophobic. No. I think that conversation must come to an end. South Africans must not feel guilty or made to be feeling guilty for voicing out what they see on the ground, particularly by the middle class here in South Africa, who don't even visit, public healthcare institutions, don't even, frequent townships or the CBDs of this country and actually witness what's happening. So I think that conversation of South Africans being branded as xenophobic is a way to shut them up because, well, you frequent, Randburg, Sandton, you are in Midrand, and you're not necessarily in Soweto, Tembisa, and Alex, and face the same challenges that ordinary South Africans are facing. And the only way to respond to the concerns that they're raising is saying, well, you're being xenophobic. No, that's unfair. But again, I think going back to my point is the fact that as much as it's well and okay to voice out some of these issues, Operation Tudula and other organizations like March and March should be also focusing on our very own government. We should be focusing on the government of the day, and showing them that, hey, you haven't been building hospitals in our townships. Our hospitals are in disarray, and there's a situation. You've let the borders become porous. Okay, you failed on that front, but now all of these people that are in the country now need medical health care. What are you going to do about it? So I think it's an approach that doesn't necessarily have to target, vulnerable people. I mean, a lady coming in pregnant, about to give birth at any moment, I think, you can't be proud and happy and say you prove proudly South African by turning them away. Or people that pride themselves in Ubuntu, I am because you are, and primary health care, I think, is Ubuntu at its highest level. But then again, our government has failed. That's why vigilantism will take part. That's why you have Operation Tutula become a movement and organization that South Africans feel like is the best avenue to voice out their grievances with, because the government is not listening. And when the government is not listening, well, we're all seeing what's happening. You can engage with us. What are your thoughts? Should undocumented foreign nationals be entitled to free healthcare in South Africa, even if they don't pay tax? Do you think South Africans are people that pride themselves in Ubuntu? We share whatever little resources that we have with our neighbors. A lot of our freedom fighters were taken care of in these African countries during the dark days of apartheid. And it's only right that, we pay back. To those that are also in our countries because of whatever reasons why they left their country. Our studio line is 0116800355. On WhatsApp, we are 0617660355. Very, very important conversation that we should be having, because no one wants to see the scenes of 2008. No one wants to see people being burnt alive, people being mob justice just because they have a different accent or they look a certain way that is not considered South African. Because at the end of the day, we're all human beings, man. Going to take a quick break. When we come back, News and Views continues.
Send food and send kindness to those who have lost their homes and have been plunged into poverty. For those